Today we are going to talk about the most commonly used macrolide antibiotic, azithromycin. The most commonly used macrolide antibiotic. It's an azalid congener. It's an azalid congener, or we can say that it is a derivative of erythromycin. Azithromycin is a newer drug. It is a derivative of erythromycin. So what are the advantages of azithromycin over erythromycin? It has expanded antimicrobial spectrum because this azithromycin is a broad spectrum macrolide antibiotic, improved pharmacokinetics, better tolerability and drug interaction profile. So these are the advantages of azithromycin over erythromycin. Now what is the mechanism of action? Mechanism of action, it binds to the 50s ribosomal subunit. It binds to the 50s ribosomal subunit and it will going to inhibit the bacterial protein synthesis. It will going to inhibit the bacterial protein synthesis. Actually, it inhibits the translocation of growing peptide chain from A site to P site. What does it do? It will inhibit the translocation of the growing peptide chain, and that's why A site is not available for binding of next amino acid which is brought by the tRNA, and hence protein synthesis stops, right? Hence protein synthesis stops. Now the drugs like chloramphenicol and clindamycin, they will also bind to the 50s ribosome, and that's why they can or they may antagonize each other's activity because they will compete for the same binding site. Azithromycin, chloramphenicol, clindamycin, they will all bind to the 50s ribosomal subunit. So they may antagonize each other's action because they will compete for the same binding site. What is the binding site over here? 50s ribosomal subunit, and hence combination should be avoided. These three drugs should not be given together. These three drugs should not be given together. So what we have seen, what is the mechanism of action? As you can see here in the picture, this is the ribosome. This is the 30th ribosomal subunit. This is the 50th ribosomal subunit, right? This is the A means acceptor site. A site means acceptor site. Then there is a P site. Now this is the mRNA. This is the messenger RNA. Now what happens? This azithromycin binds to the, where it binds? It binds to the 50s ribosomal subunit. When it binds to the 50s ribosomal subunit, what it do? It will inhibit the translocation of A site to the P site. It will inhibit the translocation. Means A site is not available. A site is not available to accept the new amino acid. For growing peptide chain, we continuously require the new amino acid for the growth of the peptide chain, right? But when it binds, azithromycin, when it binds to the 50s ribosomal subunit, it will inhibit the translocation of A site to the P site. There is a continuous translocation of A site to the P site. A site is the acceptor site. It will accept the new amino acid which is brought by the tRNA, transfer RNA. But when it binds to the 50s ribosomal subunit, it will inhibit the translocation of A site to the P site, and that's why it will inhibit the growth of peptide chain, or we can say that it will inhibit the bacterial protein synthesis. It will inhibit the bacterial protein synthesis. Now, as I told you in the advantage, better pharmacokinetic profile. So it is acid stable. It is a acid stable macrolide antibiotic. Acid stable, then rapid oral absorption when it is given on empty stomach. When it is given on empty stomach, it will get rapidly absorbed. Means that's why it is given 2 hours before meal and or either 2 hours after meal. Right? It is given either before meal or after meal, means 2 hours after meal, because it will get rapidly absorbed from the empty stomach. Larger tissue distribution and intracellular penetration. It will get distributed all over the body. So larger tissue distribution, it will get distributed widely or throughout the body, and it will also get penetrated inside the cell, intracellular penetration. So concentration in the most of the tissues exceeds that in plasma. So what happens? Concentration in the most of the tissues exceeds. Tissue concentration is more than the plasma concentration. High concentration are attained inside the macrophages and fibroblasts. As you can see here, high concentration is attained where? In macrophages and fibroblast. Macrophages and fibroblast. So that we can say that larger tissue distribution and intracellular penetration. Pharmacokinetic properties, volume of distribution is 30 liters per kg. And why it is given as a once daily dose? We have heard azithromycin is given as a once daily dose because it remains in the tissue for a longer period of time and gradually release from them, and therefore the elimination half-life of azithromycin is almost 3 days or more than 50 hours. Longer acting once daily, that's why it is given as a single daily dose, or azithromycin once a day for 3 days, because this azithromycin will remain in the tissues for a longer period of time and it is gradually released from them, and therefore the elimination half-life of the azithromycin is almost 3 days or 50 hours, more than 50 hours. Hence, in many conditions, it is effective as a single daily dose or single effective dose. It is largely excreted unchanged in the bile, and renal excretion is 10%. Renal excretion is 10%. Because of higher efficacy, better gastric tolerance, convenience once a day dosing. This is the convenient for the patient, better gastric tolerance, and have a higher efficacy. Now, as I told you, expanded antimicrobial spectrum. So, or broad spectrum macrolide. So, antimicrobial spectrum is similar to erythromycin, except it is also effective against MAC or Mycobacterium avium complex and T. gonadi, Trypanosomiasis gonadi. Means antimicrobial spectrum is similar to erythromycin. Apart from that, it is also effective against the MAC infections or Mycobacterium avium complex or T. gonadi infections. Azithromycin is more active than other macrolides against H. influenzae but less active against gram-positive cocci. This is the difference between other macrolides and azithromycin. But the most important thing about azithromycin, it is highly effective against respiratory pathogen. That's why it is given most commonly used in the upper respiratory tract infection, Mycoplasma, Chlamydia pneumoniae, Legionella, Moraxella, Campylobacter pneumoniae, Chlamydia trachomatis, Haemophilus ducreyi, Granulomatis, Neisseria gonorrhea, They are highly effective against all these pathogens or microorganisms. However, it is not active against erythromycin resistant bacteria. This is the important thing you should know. It is not active against erythromycin resistant bacteria. The only thing it is highly effective against these pathogens, penicillinase producing staph aureus are not inhibited, are inhibited but not MRSA. What they are trying to say, penicillinase producing staph aureus are inhibited, but methicillin resistant staphylococcus aureus is not inhibited by azithromycin. Azithromycin is now preferred over erythromycin as a first choice. In which conditions? In conditions like Legionnaires' pneumonia. Azithromycin is now preferred over erythromycin as a first drug of choice. Legionnaires' pneumonia, in that condition, you can give 500 milligram OD oral or intravenous for 2 weeks. Erythromycin or fluoroquinolone are the alternative for the azithromycin. Then chlamydia trachomatis, non-specific urethritis in genital infections in both men and women. 1 gram single dose is curative, while 3 weekly doses are required for the lymphogranuloma venereum. These are the therapeutic uses: Legionnaires' pneumonia, chlamydia trachomatis. In chlamydia trachomatis, 1 gram single dose is curative, but in case of lymphogranuloma venereum, 3 weekly doses are required. It is also a drug of choice for chlamydial pneumonia and is being preferred over the tetracycline for trachoma in the eye. It is preferred for the trachoma in the eye. Now, donovanosis is caused by Calamobacterium granulomatosis. So, in that case, azithromycin 500 milligram OD for 7 days, or you can give 1 gram weekly for 4 weeks. It is as effective as doxycycline. It is as effective as doxycycline. You can also give in the chancroid because of Haemophilus ducroi and penicillinase producing Neisseria gonorrhea urethritis. In that case, single 1 gram dose is highly curative and may be combined with ceftriaxone if it is required. So these are the therapeutic uses in which we can use azithromycin as a drug of choice. Now, what are the other indications? Other indications, you can give this azithromycin in pharyngitis, tonsillitis, sinusitis, otitis media, community acquired pneumonia, acute exacerbation of the chronic bronchitis, prophylaxis and treatment of the MAC infection in the AIDS patient, multi-drug resistant typhoid fever in patients allergic to cephalosporins and toxoplasmosis, right? So, broad spectrum macrolide, and it is the most commonly used, one of the most commonly used antimicrobial agent in the clinical practice because it is very safe drug. Now, as we all know, the adult doses like 500 milligram once daily, 1 hour before or 2 hours after food, because food decreases bioavailability, so it is given on empty stomach, either 1 hour before meal or 2 hours after meal for at least 3 days, or you can give for maximum 5 days. Children's above 6 months, 10 milligram per kg per day is the dose. For 3 days is sufficient for the most of the infections. Because why it is given as a single daily dose? Because elimination half-life is almost more than 50 hours. So it is in most of the infection, it is given as a single daily dose, or 3 days is sufficient for most of the infections. Adverse effects is like mild gastric upset, abdominal pain, but these adverse effects are very mild and they are less than the erythromycin. headache, dizziness can be seen. This azithromycin will not going to found or it will not going to affect the hepatic CYP3A4 enzymes. So this azithromycin is free from the drug interactions, but still interaction with theophylline, carbamazepine, warfarin, terfenadine, and cisapride is not likely, but caution may be exercised. There are means there is no such drug interaction, but you have to take care while prescribing azithromycin along with all these drugs, right? There is no effect on CYP3A4 enzymes, so it is free from the drug interaction, but still you have to take care of such things while prescribing azithromycin. Now the last thing that we all know, brand names of the azithromycin. Azithromycin 500 mg brands: Glenmark, Azifine 500 mg tab, Azimax 500 mg, Azivoc, Wockhardt, Azimax, Cipla, Alembic Pharma, Azithral, the most commonly used brand name, Azithral, which is manufactured by the Alembic Pharma, right? So these are the most commonly used brand names of the azithromycin. So that's all for today.